Please come in.
Good day, doctor.
Good day. Please take a seat.
Thank you. Doctor, I want to know more about family planning and what options do we have?
Okay, so it's a great question. Family planning is essential and you have several options. Okay, so I will introduce you the natural method and artificial method. So first, one option is natural method, so like tracking fertility and understanding your body's cycle. So next is artificial method, so such as barrier methods, hormonal methods, intrauterine devices or IUDs, and permanent methods or sterilization. And lastly, we have the emergency contraception. So I am going to introduce you one by one. For you to understand better, I will show you a video about the methods of contraception one by one.
Condoms. Condoms are a barrier method of contraception that prevents pregnancy and sexually transmitted infection. They are worn over the penis during sexual intercourse, like this. The main purpose of condoms is first, it helps to prevent pregnancy. Condoms work by physically blocking sperm from entering the vagina and preventing fertilization of eggs. Second, it protects against STIs. Condoms act as a barrier against bodily fluids that can transmit STIs, such as HIV, chlamydia, gonorrhea, and syphilis.
A cervical cup. A cervical cup is a small, shallow cup made of silicone or latex that covers the cervix to prevent sperm from entering the uterus. Easy to insert and remove. Long-lasting that can be used for up to 2 years. Spermicides. Spermicides are chemicals used to kill or immobilize sperm, preventing fertilization and pregnancy. Can be used with other birth control methods. You just have to apply the spermicide cream or gel to a diaphragm or cervical cup for added protection. Note that spermicides cannot prevent STIs.
Implant or implanton is a long-acting up to 3 years, reversible contraceptive method. Implanton must be removed by the end of the third year and may be replaced by a new implanton at the end of removal. Its continued contraceptive protection is desired. The implanton or the implant is inserted through a needle in the skin of your upper arm. The medicine is released slowly into the body from the implant. Insertion of implanton is simple. The applicator needle is positioned subdermally and the cannula is withdrawn, leaving the implant into the place. The implant is inserted or injected under the skin of your inner upper arm by trained doctor or nurse. A local anesthetic is used before the implant is inserted so that you will not feel the pain when this is happening. After the implant is inserted, you should be able to feel the implant under the skin. Depo-Provera, or also known as the birth control shot or the DMPA. It is a contraceptive injection that contains the hormone progestin. So how it works? Depo-Provera prevents pregnancy by stopping the ovaries from releasing an egg and thickening cervical mucus to prevent sperm from reaching the egg.
A vaginal ring or a birth control ring is a hormonal birth control method to prevent pregnancy in women, people assigned female or at birth. The ring releases estrogen or progestin into your body through your vaginal lining. These two hormones work together to prevent pregnancy by, first, stopping your ovaries from releasing an egg, or changing your cervical mucus to prevent sperm from reaching an egg.
The copper ID is non-hormonal contraceptive that user cover to create a toxic environment for sperm preventing fertilization. One of its main advantages is its long-term effectiveness, lasting up to 10 years without needing replacement. It offers immediate contraceptive protection upon insertion and does not involve hormones, making it suitable for those who prefer to avoid hormonal methods. The copper ID can also be used as emergency contraception if inserted within 5 days after unprotected intercourse, and it is reversible, allowing for quick return to fertility once removed. The hormonal IUD releases progestin, which thickens cervical mucus to block sperm and thinns the uterine lining, reducing the likelihood of pregnancy. One major advantage is its ability to decrease menstrual bleeding and alleviate cramps, making it beneficial for those with heavy or painful periods. It can remain effective for several years, providing long-term contraceptive without the need for daily attention.
Good day! If you're looking forward for the future without having any doubts and worry, I am glad to introduce you the two permanent methods, which includes the vasectomy and the tubal ligation. This means that you too must have undergo a surgical. For you, mister, we have the surgery that we somehow called as the vasectomy, wherein the doctor makes one or two small cuts into the scrotum to access the vas deferens. This has also to do with not allowing the sperm to enter the semen. While for you, miss, we have the surgery that we also called as the tubal ligation. Tubal ligation provides a permanent birth control. It is effective and can be done at any time. This means that your fallopian tubes are cut, blocked, and sealed up to prevent pregnancy.
The morning after pill provides a safety net for unplanned sex and contraceptive failure, preventing unwanted pregnancies and offering peace of mind. Easy to use with one-time dosage. It's highly effective up to 90% within 72 hours and accessible over the counter.
Natural family planning, also known as periodic abstinence and fertility awareness method, is a method of birth control that involves monitoring a woman's menstrual cycle and predicting her fertile and infertile periods. In order to determine when she is most likely to become pregnant, calendar-based methods involve tracking the length of the woman's menstrual cycle and using that information to determine her fertile and safe periods. The standard-based method and calendar-written method are two examples of calendar-based methods.
Every contraceptive method has its different purpose and benefits. So, it's about finding what's right for you. Let's work together and choose the best option for your needs.
Always remember to discuss your birth control options with the healthcare providers to determine the best method for you. For proper fitting, insertion instructions, and guidance on using it effectively,